This is a part 2 of how to breathe correctly for core stabilization for pelvic floor to prevent any injuries and have better workouts. In this exercise, or what I'm about to show you, we will be showing you how to engage your breathing in, engaging your rib cage, going outward instead of upward like so, and how to engage the cellophane wrap that I referred to in part 1. We're going to make sure that we have part 1 put at the end of this video. If you have not seen it, you may want to see that first and then come back to this one. So stay tuned. Hey, this is Dr. Shakib from Irvine, California, and demonstrating to you how to do proper breathing practice. And if you think, well, you've got that down because you're doing the breathing, well, you may want to think again, because I am yet to see someone, and I've seen thousands and thousands of patients in my practice, to come in knowing how to breathe correctly. So this is what you're gonna have to do. You're gonna lay down on the floor, and yes, practice it on the floor because it's easier to do since you're learning something new. You're gonna lay down with your spine all nice and neutral. Neutral means the whole spine is touching. The whole spine means the whole spine. Everything from the top all the way to here. If it's not touching, and if your neck is all in that position, you may want to elongate that. And if you can't do that, put a pillow under your head. If no matter what you're doing, for the sake of this practice, no matter what you're doing, there is still some curve there, try to press down on your feet, lift your pelvis up, and drop each vertebra down towards the floor one at a time without lifting your chest up. So now that your spine is nicely neutral and your neck is elongated, you're gonna breathe through the nose. You're gonna place your hands on your rib cage, the lower part of your rib cage, and breathe into your hands. So I'm gonna demonstrate. Let me breathe out first. Desiree, can you see my hands coming out or not really?
Try again. A little bit.
You want to come closer?
I'm zoomed in.
You're zoomed in, very nice. So concentrate on the hand. Now we're going to move towards that cellophane wrap. You want to make sure, so I'm going to demonstrate here how to do that wrong when that's lifted and the bowl is tipped down. You can see the curve, so we want to make sure it's tipped up until the very bottom part of your spine is touching the ground. Don't over tuck. So that's that. Now we're gonna breathe in, think about the cellophane wrap, and in that case, you're gonna place your fingers over the lower part of your abdomen. I'm referring, so if this is your pubic area, you're gonna place your hands on the sides, the lower part of your abdomen, and your thumbs will be going to the side of your body, because what you wanna feel is when you're applying pressure on that cellophane wrap and you're breathing in, you want to feel the abdomen pushing against your fingers and the thumbs pushing and being pushed out. You're trying to create a cylinder, a barrel, and trying to get to the bottom of the barrel. So this is the top of the barrel, that's the bottom, front, back, and the sides. So I'm placing my hands on the lower part of the front and on the sides to practice the proper breathing. So first is expansion at the rib cage, then it's the tapping of my abdomen into the fingertips and the thumb. So It's going to be, once again, neutral spine. And if you're doing this correctly, as you breathe in, and you've already practiced expanding your lower part of your lungs into your hand with breathing in, once you get that down, which can take more than 3 or 4 breaths, then place your hand lower and practice engaging that cellophane wrap pressure. And so place your hand there, and you should feel that pushing out, so you're making your barrel or your cylinder thicker, and then with breathing out, thinner. Keep in mind that as you're doing that, you're gonna have to realize that the pressure on the cellophane wrap decreases and increases, and the goal is for it to not go away. So you're really making a nice, strong lower part of this barrel. This is important in stabilizing your pelvis. This is important in stabilizing your torso, and that's a requirement to prevent any injuries and making sure that your torso, which is the stabilizing component of your moving mechanism, stays stabilized throughout all of your movements. So you'll have less injuries, less pain in different parts. If you have imbalance in your pelvis, which is everyone's story because we're behind the computer so much, or if you have pelvic floor dysfunction, these are all helpful for that kind of breathing. I hope this helps. It's a lot to absorb, and you may think, oh my gosh, why are there so many things to remember? How am I gonna remember that? Just practice it. Listen, you've already done it automatically as a baby. At the very beginning, you can do it again. Your brain is wired to breathe like this. So do what your brain is programmed to do. You increase your chances and you live a healthier life, moving around safely and with more balance. If you have any questions, or if you'd like to be seen at the office to see what the status of your functional movement or pelvic floor dysfunction is, give me a call. Thanks for watching.